Hello, everyone. Thank you so much for joining us today at Harmonic Evolution Spa. I wanted to review with you lower face neurotoxins. That's what our lecture is going to be on today. This lecture will be a short lecture for your lunch break, and afterward, I'll be taking questions. So, what are neurotoxins? Neurotoxins are derived from botulinum toxin. And this is derived from naturally occurring bacterium Clostridium botulinum in nature. It's one of the most potent toxins and acts directly on our nervous systems. Within the nerve, we have our presynaptic nerve and postsynaptic nerve. So this neurotoxin acts directly on the presynaptic area of the nerve to decrease the release of acetylcholine, which allows activation of muscles. So it's going to prevent muscle contraction. This is an image of the synapses of the nerve and how it's actually blocking the nerve itself. So with endocytosis of the toxin, it goes into the nerve and then it separates and becomes activated and prevents the synapses of the acetylcholine to the outside of the nerve so it never gets released. So what are the brands of neurotoxins? You may have heard of Botox. That's a very common one, very popular. We hear that a lot in aesthetics. But there's also Dysport, Xeomin, um, Jeuveau, and Daxxify. So these neurotoxins are all different products that we can utilize to help paralyze the muscle. And we can use all of these in aesthetics. They all have specific indications, but overall, we're using that to help get rid of these fine lines that are unwanted. So one of the things that we can utilize this for, aside from our forehead and the crow's feet that we're all used to, is the marionette line. So you can see in this picture, as this patient is frowning, she has a very significant frown face, and sometimes it can also be seen at rest as well. So we want to inject here on the bottom of the face, the lower half of the face, in order to help prevent that muscle from depressing the edges of the lip. So what is the process of getting these marionette lines? Some of it is genetics, but also it's a loss of collagen elasticity of the lower face. So we do see this happening as we age. We get that downturned face, which we didn't used to have when we were younger. Sun exposure can affect this, and also smoking as well. And this is just an image of the muscle that I was speaking of, the depressor anguli muscle at the sides of the face. So you can see in green here on the image. Treatments can vary, but neurotoxin is an option for this. And it's one of my favorites for this area to help that downturned face. It does have a high safety profile. Possible risks with this include smile asymmetry. And then another area in which we can inject toxins are the chin. So you can see in this patient here, the wrinkling of the chin, and also there's a line that's starting to form or a crease just above the chin. So the activation muscle here is the mentalis muscle. You can have a genetic predisposition to this. Some people have a little bit more stronger muscle that's able to cause wrinkling of the area, which is a little bit more common depending on our facial expressions. Again, sun exposure, smoking are all risk factors for this. And it can cause what's called peau d'orange, which is these little tiny dimples that you see on this patient here. And then also over time, as you notice that crease that I just mentioned, the chin and the profile can start to push forward because that muscle is shortening and contracting so much, it's pushing the chin forward. So again, this can be treated with neurotoxin. It allows for a more youthful look and also relaxes that protruding of the chin and can prevent that crease there and also the peau d'orange as well. And then we have a gummy smile. This is caused by several different etiologies, or several different things can cause this. The hypertrophied gums can be an issue here. Teeth that are small in comparison to the gums. short or hyperactive upper lip, and overgrowth of the upper jaw. So not everything on all of these etiologies can be treated with neurotoxin, but especially those with issues of the shortening of the upper lip. This is a really great treatment. It's very simple, straightforward, low profile risk, and you can get great results with this. And then also we can treat the lips and lines with our neurotoxin. So you can do something called a lip flip. With the lip flip, this is an upturning of the lips. So instead of getting a filler in the upper lip, if you just want to get a little fullness and have that nice full upper lip, you can add a little bit of neurotoxin. Just a few units will give you that effect. And a lot of people do like that as a stepping stone to see what their filler might look like. It's not going to give you that overfilled lip, but it will give you a little bit of a change in the contour so that you can see what that lip filler may look like in the future for you. And then the lip lines. This is something very common in which we treat with neurotoxin. It can relax the muscles around the mouth to smooth out the thin lines. And it's also good for preventing these lines from coming in the future. So if you're starting to see lines form, that's really the best time to get this done, but certainly you can get it done when you do have those lines there. And then also we have neurotoxin of the jaw. So for those patients that have the very strong masseter or prominent masseter muscle on the side of the face, this can relax and atrophy the muscle to allow a soft and rounded look of the jawline. When you see these patients with this product over time, they can get a really nice, soft, feminine look to the face. So if you've got a really angulated jaw and you have a very large muscle there, it can really make a beautiful, soft line for you. It can also help with TMJ as well, and a lot of dentists do use this in their office. So this was just a short introduction of lower face Botox. I wanted to give you guys insight into what other things we can do, lower face neurotoxin. I wanted to give you guys an insight on what we can do with lower face neurotoxins. It's not just for the upper face, and it's not just for the crow's feet or the lines above the forehead. We can do other things with it as well. So keep an open mind and come into the office for a full face consultation. I'm going to go ahead and open up the floor to questions. Thank you.